Hi, I'm Dr. Sian Cole, Senior Health Psychologist, and today's video is an educational video on the psychological consequences of taking corticosteroids. Now, please understand this is an educational video and is not giving any medical advice, so always talk to your treating doctors in regards to discussions around taking your medications. This video is really more about being able to help people understand some of the side effects in regards to taking corticosteroids to actually help people adhere to their treatment. So there are many names of corticosteroids such as prednisolone, methylprednisolone, dexamethasone, hydrocortisone. If you're unsure if you're on a corticosteroid, just talk to your doctor about it. So corticosteroids are used for their anti-inflammatory properties and their immune suppressant properties as well. They can be extremely valuable medications and even life-saving. Some of the reasons that people take corticosteroids is for things like severe allergies, including anaphylaxis, autoimmune conditions such as rheumatoid arthritis, lupus, MS, and also for acute inflammation or recovering from surgeries. People may be on some high doses of corticosteroids to actually help the body to heal. So I'm just going to talk about some of the common physical side effects of being on corticosteroids. Insomnia or sleep difficulties is a very common one. Increased appetite and gradual weight gain. Slow wound healing. Bruising, thinning of the skin. People can also complain maybe of a headache or dizziness, or feeling kind of bloated or nauseous in their stomach. And people who might be on corticosteroids for a long time can have some changes to the way that their body distributes their fat as well. But what this video is really about is about talking about some of the common psychological side effects of corticosteroids. One thing to note is that when people do take corticosteroids is that it does break down to cortisol, the stress hormone. So it makes sense that people are going to be feeling all sorts of kind of psychological stress symptoms from being on these medications. So this can include feeling irritable, upset, frustrated, having a bit of a sensitive reaction, and sometimes even feeling like you're going to have a panic attack or having a panic attack. Some people might feel that they can't control their crying or their behaviours are a bit more impulsive. Sometimes on a very high dose they might even be confused, disorientated, or even develop maybe some symptoms of things like psychosis or mania. While other people actually might feel really euphoric on high doses of corticosteroids. So sometimes when they start to cut down, they might then start to feel flat and depressed and have no energy. So one reason why I think it's important to let people know about these symptoms of taking corticosteroids is that people are not developing a psychological disorder or going crazy. It is a byproduct of these medications that are really valuable for people's overall health, and that you're not going to be on these medications generally forever. Most of the time they're used in a short duration and people are kind of cut down as quickly as they can depending on how well their body's going with the physical health problems. So if you feel like you're struggling with any of these symptoms, please talk to your treating team, your nurse, your doctor, so you can have discussions around how to best manage these or what the plan is in regards to how long you'll be on these medications or when you might be able to cut down. So don't cease any medication without medical advice, and I do hope this information was helpful.